On my social media channels, I constantly use a hashtag test, not guess. And there's nobody that listens to this podcast or the clips that should be without knowledge of their carotid vascular age, a simple, safe ultrasound, their coronary heart disease vascular age, which will require a CT scan, a basic one at about $100 cost without injecting anything, or a more advanced one that will be more expensive. It involves the injection of iodine contrast. But nobody should be guessing and playing roulette with their health until they know their heart disease status. And they can do all the fancy anti-aging things later, but step one, tell me your vascular age, and I'll tell you if you're going to be around here in 10 to 20 years.
Hello, and welcome to Legends of Longevity with me, Joseph Ence. I'm your host, and I'm thrilled to have you join me on this journey towards living a longer, stronger, and more vibrant life. The podcast is about uncovering the secrets to longevity, things your doctor does not tell you, whether it's groundbreaking advancements in heart health, lifestyle tips to keep you thriving, or inspired stories of people who've defied the odds. Together, we'll explore the tools, techniques, and mindset shifts that can help you unlock your fullest potential. Whether you're here to learn how to enhance your well-being, support your loved ones, or just stay ahead of the curve in health and wellness, you're in the right place. Let's empower each other to not only live longer, but live stronger.
Welcome to Legends of Longevity. I'm here with Dr. Joel Kahn, talking about the best in science to make your life better, to think clearer, and to feel more ambitious. We're here having recently come back from the Longevity Fest in Vegas, and we saw a lot of interesting stuff there. Doc, what did you see, and what did you think was different?
Well, it's more about what I didn't see, and it's what I never see. And I'm not saying this because you're in the field of vascular imaging, but people talk about longevity and they don't talk about arteries. And frankly, I have to snicker. If you're in the longevity space and the first thing that comes out of your mouth isn't talking about vascular age, atherosclerosis, yeah, I take 102 supplements a day, and I do cold plunges and stem cells and all the other things, IV, NAD. But I've never had a carotid ultrasound like Vascular Labs provides at a very high quality. I've never had a calcium score or a more advanced coronary CT angiogram. I've had basic labs at my family doctor 2 years ago, but I haven't had advanced labs. And I don't think I've seen the dentist in 4 or 5 years. I mean, if that's a conversation, then we missed the boat. And unfortunately, that's one of the beefs I have. I'm not a beef eater, but it's one of the beefs I have with, a typical longevity program. The first 3 speakers should be cardiologists or vascular biologists or cholesterol experts or imaging experts. And I always say, if you really want to live a long life, step 1, check your arteries. Step 2, if your arteries are clean, yeah, there may be some other things to do, but if your arteries have disease, that should probably occupy 90% of your time figuring out how to stop, halt, and reverse what we found by testing that's widely available. So I didn't walk away from there with a feeling that there was something so hot because step 1 wasn't being done. Check your arteries.
Yeah, getting a good baseline. We've been advertising online to get patients who just want this test. And I'm attracting a type of patient that's very interesting. They've woken up in the last year or 2. They've cut out seed oils. They've cut out corn syrup. And now they're looking to create this new lifestyle for themselves. What kind of lifestyles are legitimate options, and which do you think are a waste?
Right. Well, I think it's good that people are waking up to examine their lifestyle. You mentioned some inputs. I say this rather boldly because after 35 years of practicing cardiology, I have rather bold opinions. You're not going to enjoy life if you drop dead on Christmas or New Year's. And those are the 2 highest days to drop dead. And you drop dead of heart disease. You don't drop dead of, wrinkled skin. You drop dead because of heart disease. So, you need to know your arterial age. That's a real concept. Some people call it vascular age. You're 60 years old. You want to know if your arteries are like a 50-year-old or an 85-year-old. And then you want to plan, of course, to implement to either keep the good news or try and reverse the bad news. So, and then the fundamentals of lifestyle, they're not seed oils as a fundamental. That's an add-on. The fundamentals are we have so much data now, getting 8 hours of sleep a night, 7 to 8. Many people struggle with that, trying to get as good a continuous sleep, uninterrupted sleep. In fact, many longevity experts put sleep as their number one lifestyle goal before any other. Number two, there'd be no controversy to talk about regular fitness, some combination of cardio and strength training, and maybe some flexibility and even balance training. You can do these all together. I mean, yoga kind of does them all together, but there's ways to do them separately. Number three, don't smoke. There's not going to be a whole lot of controversy about that. Number four is nutrition. Oh my God, we just stepped on a landmine, of course. We got the carnivores, and we got the ketovores, and we got the paleovores, and we got the Mediterraneanites, and we got the vegetarianism, and we have my camp, the camp that has almost all the data, which is the plant eaters. I'm not vegan for 48 years because I own a broccoli farm. I'm vegan for 48 years because 98% of the science says my prostate loves broccoli, my sperm count loves broccoli, my blood vessels, I know they love broccoli because I have no atherosclerosis in my body at age 65. And there are some carnivores that can say the same, but my blood sugar is low because it loves broccoli, and I don't eat only broccoli. I eat all kinds of plants. But anyways, nutrition just explodes people in screaming at each other about protein and supplements and all. But if you really stick to the science, 98% of it, and I'm not overestimating, 98% of a very large science body says diabetes, cancer, heart disease, brain health are maximized by a regular consumption of a whole lot of plant-based fiber. And I've not yet seen a T-bone steak that has fiber in it. There is not one. So then you get the add-ons. You get the infrared saunas, and you get important stress management and breathing techniques and ways to hack stress. That's important. We argue cold plunge, not a whole lot of data about cold plunge. We certainly can go on and on about supplements. The show we just came back from features so many supplements. I'm a supplement guy, but, can't say any of them are proven. And in fact, one of the world's best known longevity subjects, Brian Johnson, the guy who's got the Blueprint protocol, just announced he's stopping rapamycin because after 5 years, he can't document one improvement in his health from rapamycin. So that's sort of, to me, something I agree with, actually, something that we would disagree with Peter Attia, MD, but I agree with Brian Johnson, actually. It's hopeful, but come on, do some more research before we put the whole world on rapamycin. So those are some foundations of lifestyle.
What are your thoughts on peptides right now? Those are super hot. Clinics popping up everywhere.
Peptides are hot. There's more data for lentils than peptides. I mean, actually, and I'm not joking, if you look at
that's a good one.
If you look at a population of people over age 70, lentils are the number one food for longevity. These are published, studies. They also, not joking, I don't own a lentil farm either, but lentils happen to be legumes in general, peas, beans, and lentils, beans, peas, and lentils, happen to be the common food in all the longevity zones that we call the blue zones. If you said, what's the one food in common in all the blue zones? It's actually legumes. So I'd rather people up their lentil intake before they start injecting 7 peptides a day. I know it's exciting. There are some oral peptides, and I'm not actually joking. There is one from lentils called Peptistrong that has some rather profound oral metabolic reactions. But to claim that the problem for the explosion in chronic diseases in America that Robert Kennedy Jr. hopes to tackle, to claim that the response should be peptides is about 20 years, premature. One, they're expensive. Two, they're, largely untested. Not everything has to be tested and published in the National Library of Medicine PubMed. But you head over there, you're not going to find, a whole lot of convincing long-term studies with the whole range of peptides. So I'm a little cautious with them at this point.
Yeah, peptides is kind of fun, and it is exciting. I do a lot of pitches. I go to a lot of different offices, and this one office was holding a peptide party. They brought out a silver tray with all these bottles, droppers, everything you could imagine.
Was P. Diddy there by any chance?
You know,
P.
now that I think
P. and P. Diddy was peptides, I think.
Is that what he had in the baby oil?
I think the baby oil was indeed a peptide solution.
Anyways, yeah, it's just we're trying all the new stuff for brain acuity, and there's whole worlds to go, but there's not a lot of research, like you say. There's not a lot of good sourcing of materials. You really got to be careful and be happy with your client.
I would make the same statement I made about, embracing longevity research, but not focusing on cardiovascular disease. I mean, if you're injecting peptides or possibly taking some orally, because there are some that you can take orally, BPC 157, for example, and you're not going to the gym, and you're not eating a whole food plant-based center diet, and you're not getting 7 to 8 hours sleep, and you're not checking your arteries and your lab work and the rest. I mean, God bless you, enjoy your peptides, but you're missing the boat. And unfortunately, it sounds like I can take my peptides and skip a really, well done health evaluation focusing on cardiovascular and cardiometabolic health. No, you can't. And as I say again, the solution for the chronic disease problem in America is not peptides. It may be broccoli.
You're not kind of joking, but that's real. Like, we got to eat our way out of this problem because we ate our way into it. And
right,
getting good foods, like it's got to be a whole deliberate thing. And when I'm talking lifestyle, it's a big thing. Changing your diet. I mean, these are habits that you've developed and have and are comfortable for you. And then you got the other side of the spectrum where a doctor will order a statin without doing what they should, lose weight. Have you worked on this, that, the other? Because that's the only thing the patient's going to do. That's the only thing they can do is they're only going to take a peptide. They're not going to eat better food. They're not going to go walking. They're not going to get a dog. They're not going to do breathing exercises. But every patient, should they have that channel making open to them, and when they see that plaque in their artery, that's a good motivational tool to show your patient, hey, we got something to work on here. It's getting that enlistment. And I know a lot of docs have problems getting patients enlisted or really get that motivational aspect. So by the time the patient's seen you, they're pretty well decided they're gonna listen to what you say and go at it. Or are you finding you attract a lot of patients that want to use you as a coach?
I see all kinds of patients. I love them all, but I got a lot of fruitcakes, to quote Jimmy Buffett. I have people that really should be on statins because I've documented their carotid vascular disease, very detailed coronary vascular disease, their inflammation panel, their genetic, input for future cardiac events like stroke and heart attack. And no way, Jose, are they going on a statin. So I work with them. I document that they refuse it. We've got the whole range of dietary changes, fitness changes, hormonal balancing, sleep therapy, and a lot of supplements. I can't tell them what to do. I can only guide them. And it doesn't work out badly for them all the time. There are people that walk away from standard recommendations, and 15 years later, they're saying, I'm fine. Thank you. I'm glad I didn't do what you recommended to me. And it's humbling. But, we've got the problem that you just pointed out, that what we call a pill for every ill. Your sugar's up, you get a pill, or you get an injection. Your cholesterol's up, you get a pill or an injection, because we have that too. Your uric acid is up, you get a pill. We don't have a system that's provided a lot of nutrition education or lifestyle education to the rank and file medical world. It takes time. It's hard for people to change their dietary habits. There's a famous statement, it's easier to change a person's religion than change their diet. I think that was the famous anthropologist Margaret Mead who said that, a woman of great prominence. And it's true, and we need to have, and maybe the new medicine, the Maha medicine, will have greater access to education for both nurses, doctors, dentists, medical students, and it'll filter down hopefully to patients and access to dietitians and credible, education for them. Of course, a patient can go to YouTube right now and get a recipe for their medical problem that ranges from, 100% beef to 100% plants and think that they're of equal academic authority, but they're clearly not.
Fascinating. Wow. Let me gather that together, because these patients are changing behavior, they're changing diets, and they're piecing together this information, a lot of them from podcasts and from books.
Right.
And precious few Americans read books.
Yeah.
Most of this information is coming out through podcasts.
It is, the world of podcasts, the world of, YouTube, and I'm not a TikToker. I'm very involved in social media, but I'm not a TikToker if it continues to exist. But you're right. That's where people are seeing examples. People seem to look better. I had a patient today with coronary artery disease and carotid interval thickness abnormalities, and his cholesterol is suboptimal. And he's going to try very hard for 3 months, something called the portfolio diet. The portfolio diet is a published pattern of eating, not dissimilar from the Mediterranean diet, but specifically to lower cholesterol, backed in the last year or two by a massive study at Harvard School of Public Health that it can lower cholesterol, but also reduce stroke risk, heart attack risk, and the rest. But he sheepishly had to tell me that his wife, who's been a patient of mine, but she's embarrassed to come back, watched a YouTube and has embraced the carnivore diet and did lose weight because she used to eat chips all the time. And she used to graze at night out of stress. She's a working professional. And now, she finds that a 16-ounce T-bone at night fills her up and she's not eating chips. So, yeah, she's improved her diet. She's gotten rid of, processed food and ultra-processed food and refined sugars and refined carbs, and she feels better and lost weight. So that's where people are going to. They're watching Michaela Peterson, and I wish her well, but a well-known carnivore, or my medical buddy, Sean Baker, an orthopedic surgeon, give advice for every ailment under the sun. So, no, I think we need a wide toolbox. As I say, it's easier to start with uniform recommendations for fitness, uniform recommendations to don't smoke, uniform recommendations to sleep adequately and how to do that. I don't think there has to be one diet that is recommended by doctors that can be arranged, but it should be the most scientific approach to it. Right now the USDA is going through their every 5-year cycle of it, the advisory committee, then the final recommendations. I don't have any reason to believe that it's a highly biased group. It's a highly academic group. And it sounds like it's going to be a very plant-forward pattern of eating recommended by the USDA. Now, I don't have that much confidence in the government, but I have confidence in people like Chris Gardner, PhD, who's nutrition professor at Stanford and is a plant-based human recently because he just knows the data and seen the benefit. Or Walter Longo, PhD, professor of nutrition at the University of Southern California, has got one of the largest portfolio of nutrition publications in major journals that focus on longevity. So anyways, we'll see what the USDA advisory board comes out. But you're right, people can shop around and always find that nice, comforting chiropractor or dietitian or podiatrist, but occasionally even a bona fide national level researcher with a PhD or an MD say what they want to hear.
Yep. Say what you want to hear. Do you remember Chris Esselstyn? I think Dr. Esselstyn, he talked about reversal of heart disease on a vegetarian diet. Is that the right name?
It's a completely plant-based diet.
Completely plant-based. And I once went to a medical conference where he started, I think it was at Cleveland Clinic back in the day, and he showed how a vegetarian you can reverse it. And he has 2 pictures of the a descending aorta, and it's opening up like legitimate. I wish he had more pictures. And then at the end of the conference, it was Forks Over Knives was the speaker, the keynote, and he was a meat-based diet. And probably me and a lot of other consumers don't really know how to reconcile this because, the different diets. And I know there's power in legumes, like we started out with in the Bible. That's biblical, that they're one of the more nutritious, healthy things that we can eat. But I don't know. A lot of people are kind of confused about it all.
Yeah, and you're referring to the great Caldwell Esselstyn, MD, who still is at the Cleveland Clinic in the nutrition program. I just spoke to him the other day on his 91st birthday and wished him well. He was still counseling patients by phone and does see a few live at the Cleveland Clinic. He's certainly a legend, starting in 1985 on a project that continues to document and publish the results of a whole food, plant-based diet, naturally low in fat content. And you're right, he's published dramatic and verified angiograms of heart disease reversing and symptoms of chest pain reversing and symptoms of leg pain on walking reversing. And I will tell you, it works. It's easy for some people. It's a little hard in a restaurant world to eat the way he describes. It's a lot of home cooking, which nowadays is probably the safest and best way to eat anyways, to pick higher quality and cleaner foods. And of course, you can't talk about that kind of level of research without also mentioning Dr. Dean Ornish, MD, in the San Francisco Bay Area, and randomized studies in advanced heart disease. And now, in 2024, he published randomized studies in early dementia of using whole food, plant-based diet and lifestyle alterations to actually document improvements in memory and the rest. So very exciting data. And that's just what's absent from the paleo, keto, carnivore world. These were small studies. Dr. Ornish always said, you don't need a big study when you're studying parachutes for jumping out of a plane. You need a very small study. And if you have advanced heart disease patients and half get a dietary lifestyle program and half stay on the standard program, and very quickly one group feels better and is documented to have better coronary and carotid anatomy, you don't need a large study. You need a large study when the differences are small. You need a small study when the differences are big. So interesting and provocative.
Right. And I'm noticing that the big studies are usually funded by pharma. Very, very few nutrition studies that have big populations. They just can't afford to do it. They don't get the funding like they need to.
Right.
So you're finding that the information you're going to get is biased. And like I tell patients, pay attention to the reps that go by your doctor's office because they leave a message and your doctor practices differently based off of the reps that go by. I've seen diabetes reps do a hard sale on a doc. Hey doc, can I have your next 5 patients for this diabetes problem so you can see that my drug gets better? Yeah. And you got to be cautious of it. A lot of these doctors that do 10-minute appointments that don't really give you a lot of time, they got a boss and they got to see a patient every 10 minutes. So when patients are learning and shopping, make sure you can get the right info and that information is not tainted. Right. Like the information you've been dropping on this recording is, I'm going to look up all these. And
I'm optimistic that there's a conversation going on, again, under the heading Make America Healthy Again, to ask these hard questions that haven't been asked. But as an example, what you just mentioned, I have a short lunch break during my day when I am seeing patients all day long, which is every day, fortunately, very busy. And I walk up and down the halls in my building just to get a little break. In the summer, it might be outside, but right now it's not outside. And I walk by the group of diabetic experts that are down the hall. And it turns out there's a glass door that is their lunchroom. And I'm telling you, every day there's a pharmaceutical rep and there's a lunch, and there's nurses and doctors. And I just happened to be walking by when this is happening. And, it's boxes of pepperoni pizza. It's boxes of Mexican food with lots of ground beef. It's boxes of, breadsticks dipped in very oily, poor quality tomato sauce. And basically, the food that causes diabetes is being brought every day to a diabetic expert office of a series of doctors. So you ask, what's wrong here and what are they actually telling their patients inside other than pharmaceutical options for their diabetes, when we know, you can not only dramatically improve, but you actually can put diabetes into remission where you don't need any medication, diabetes type 2, and you need far fewer medication for diabetes type 1 with a range of nutrition programs that actually go from low carb keto. It has been shown to help, but certainly also includes the Esselstyn diet, the Ornish diet, the Forks Over Knives diet, the whole food plant-based diet. So what's going on when there's, pepperoni pizza for the doctors that are writing the prescription? It just doesn't make sense.
No, they don't believe it. They don't believe the poison in that stuff.
Huh.
Interesting. Thank you, Doc, for your time. We've burned up our half hour.
Okay.
We've gone over some really good information. I appreciate it. And this is going out to people who are on the hunt. They're on their journey trying to find.
And my parting shot is the same way I started. On my social media channels, I constantly use a hashtag test, not guess. And there's nobody that listens to this podcast or the clips that should be without knowledge of their carotid vascular age, a simple, safe ultrasound, their coronary heart disease vascular age, which will require a CT scan, a basic one at about $100 cost without injecting anything, or a more advanced one that will be more expensive that involves the injection of iodine contrast. But nobody should be guessing and playing roulette with their health until they know their heart disease status. And they can do all the fancy anti-aging things later, but step one, tell me your vascular age, and I'll tell you if you're going to be around here in 10 to 20 years.
Exactly. Joel Kahn, one of the best doctors in the world for the rich and famous, travels, speaks, writes, still a restaurant owner?
Thank goodness that's a past tense in my bio. And I have a lot of people of limited income. So I'll take you whether you own a multi-billion-dollar company or not.
Yeah, Joel is a healer, and that's a precious commodity now. Healer that's independent and will give you the straight truth. Thanks for being on the show, Doc.
Thank you.